May is Mental Health Awareness Month. Cornerstone Care Community Health Centers are committed to providing quality, comprehensive health care to patients since 1978, and mental health treatment is an important part of that healthcare equation. And while the medical community has made great strides to remove the stigma of mental health care, we still have more work to do. According to the CDC, 1 in 5 Americans will experience some sort of mental health issue each year. This may be your neighbor who is battling depression, your aunt who is overwhelmed with anxiety, your child who is falling behind in school due to ADHD, your grandparent or parent who is diagnosed with dementia, or maybe even you are struggling with mental health issues. Sadly, even with all of the efforts to decrease the stigma of seeking mental health treatment, the CDC reports that of those 1 in 5 Americans, nearly 60% of them do not seek treatment. This may be due to fears of being judged, concerns about payment, lack of available treatment resources, or other barriers to care. At Cornerstone Care, we aim to help all patients overcome those barriers to ensure everyone has access to treatment. Mental health issues affect all aspects of our lives and our ability to function on a day-to-day basis. This can include being able to maintain a job. According to a recent study published in the Harvard Business Review, half of young adults ages 23 to 29 have left jobs for mental health reasons. Mental health issues can lead to a total inability to function, causing disability. Depression is the leading cause of disability worldwide, according to the World Health Organization. Ensuring patients have access to treatment for their depression does not simply mean they will be happier, it also means they will have more fulfilling and productive lives. Everyone has been impacted by the pandemic in some manner. The 2021 Kaiser Family Foundation Health Tracking Poll found that 45% of adults indicated that the pandemic has affected their mental health. But unfortunately, some have been affected more than others. 19% of adults indicated that it had a major impact on their mental health. Now, more than ever, we must ensure everyone has access to treatment. When discussing mental health, suicide is a matter of serious concern. According to the CDC, suicide is one of the leading causes of death in the United States, with 45,979 reported deaths in 2020. This is about 1 death every 11 minutes, which is a tragic statistic. And while suicide can be complicated, being aware of warning signs and how to get help can save lives. If you or anyone you know is struggling with thoughts of suicide or experiencing a mental health emergency, please call 911 or go to your local emergency department. You can also contact your local county crisis service provider, who can provide emergency mental health services. County crisis services are available in each county through the following service providers. Make note of your local service provider. According to the Health Resources and Services Administration, or HRSA, 115 million Americans live in a mental health shortage area. Adequate access to treatment can prevent mental health crises or suicide. Cornerstone Care's mission is to eliminate barriers to care and to provide treatment to all patients, especially patients in underserved communities. Cornerstone Care's psychiatry and counseling departments are located in Burgettstown, Pennsylvania, Clareton, Pennsylvania, Greensboro, Pennsylvania, Mount Morris, Pennsylvania, Washington, Pennsylvania, and in Waynesburg, Pennsylvania. If you or someone you love is needing mental health treatment, contact your local Cornerstone Care Psychiatry and Counseling Clinic office.